Hello friends, welcome back to Dr. Jagdi's Academy. In today's video, I will discuss about the drugs which can be used in the management of cervical spondylitis. But I will discuss the homeopathic drugs. Actually, my friends and my students, they asked me that I should discuss about the homeopathic drugs. Okay, so on their suggestion, I am making this video. So I will discuss what are the commonly used drugs in the management of cervical spondylitis. Okay, so try after watching this video, do give me feedback whether you like this video or what kind of things you need. So accordingly, I will make the next video. So now first I will just want to discuss what is cervical spondylitis. Cervical spondylitis means there is a pain in the neck region. Okay, so not only in the neck region but in the back portion. The back portion, the shoulders, there is an intense pain. Particularly if it is very severe, there can be the vertigo. We can say chakarana. So this is the thing which can happen, severe conditions. And in a very severe condition, the pain which is from the neck, in the shoulders, in the upper back, it can move in the downward direction in the back, in the arms. And mainly it is because of the bad posture. Prolonged sitting, like the students who are working on the laptops, or the person who teachers, okay, or anyone who is going for a prolonged sitting, lack of exercise. So these are the things which happen in the cervical spondylitis. So it is a very common problem. So particularly the pain happens when the person goes for a sleep. What happens is that because when he is trying to take the side during the sleep, there is an intense pain. So what are the drugs which we can give in the cervical spondylitis? First of all, I will discuss a very important drug in this one, that is the Simvastatin racemosa. This is the, you can say, one of the preferred agent. Sometimes the name is not written Simvastatin, sometimes the name is Actia racemosa, but these are the same thing. Okay, so the drug can be available in both the names. Now, what kind of symptoms are identified in this drug? There is a stiffness, there is a contraction in the neck, in the back. Again, the typical symptoms of the cervical. Then you can see this drug is having a very good effect on the muscular system. Whenever there is a muscle pain, particularly in the upper part of the body, it is very effective. And as I told, it is one of the preferred agent in the cervical spondylitis. So what is the dose? You can give the dose either in the 30C potency, 2 or 3 times a day, or you can use the 200 potency 2 or 3 times a day. Now you don't have to give this drug for the whole life. Actually, depending upon the symptoms, if the symptoms are very severe, then you can use the high potency. But symptoms are relatively low, you can use the low potency. You can give for the 2 days, 3 days, 4 days, or at the most 1 week or 10 to 15 days, not more than that one. And try to reduce the reasons of cervical spondylitis. That is, try to improve the posture, try to do the exercise. Okay, but this is effective drug if the symptoms are not relieved by good posture, etc. Second drug. This is again a very important drug, Cocculus indicus. It is particularly useful if along with the cervical there is a vertigo. That means if chakarana, what you say, if this is important, then you can give this drug, cervical, in the Cocculus indicus. So again, there is a spasm in the cervical muscle, intense spasm, contraction is there in the muscles, in the upper part of the back. Shoulder pain, pain in the arms, again an important symptom. Stiffness on moving the shoulders. When you try to move the shoulders, you feel they are very stiff, they are not moving normally. And sometimes there is a cracking of the cervical vertebrae. So these are the typical symptoms, but this symptom is very important, vertigo. So again, the doses, you can give the 30C if there is a mild condition, 2 to 3 times a day, or 200C you can give 1 or 2 times a day. Third drug, again a very important drug, Carbonium sulphoratum, again a very important drug. very effective for the pain in the cervical region. And you feel that in the scapular region, scapula means on the shoulder, you feel that there is a heavy load, heavy pressure is there on the load on the shoulder. So there is a pain between the scapula. That means between the two shoulders, there is a region which is on the shoulder. On the shoulder itself, scapula, you feel the pain. And then the dose is same, 30C or 200C. 2 to 3 times a day or 1 to 2 times a day. Carbonium sulfurator. Then again a very important drug, Magnesium tinctoria. Apart from the cervical, it can be used if there is a torticollis. Torticollis, what is the meaning of this one? If you speak in a normal language, आपको बोलते हैं नस चढ़ गई. Okay, when your neck is stiff, twisted neck, dystonia, very pain in the neck region, particularly the neck region, dystonia, torticollis, and you cannot move your neck, stiffness in the neck, pain in the nape means the back of the neck. So this is very effective. Cervical, effective in cervical also, but in this condition also. Dose is same, you can use the 30C or you can use the 200C. The last drug that I want to discuss is the Magnesia phosphorica. Very commonly it is called as Magphos. It is a very, very important household remedy, not only in the cervical spondylitis. I will discuss in my subsequent videos. Number of diseases are there, common occurring diseases in which Magphos is very effective. Why it is very effective? Because it is an antispasmodic drug. Spasm, contraction, when there is an intense contraction of the muscles, it relieves that contraction. Okay, so it is an antispasmodic action. So when there is an intense spasm, intense contraction on the cervical muscles, this Magphos is very effective. Doses again you can use either a 30C or a 200C. So now these are the 5 drugs that I wanted to discuss with you. So now you can use these drugs in different combinations. You can use 2 drugs at a time in combination. Okay, you can add one of the drugs Simvastatin, and second drug you can add depending on what kind of symptoms are there. Okay, so if you see the severity is very high, then you can use 3 drugs also, 2 drugs plus 1 more drug. So as I told, don't give the drugs for a you can say for a lifelong, but for 2 days, 3 days, 5 days, 7 days, 10 days, not more than that days, and try to improve the posture, etc. So this is what I wanted to discuss with you. So give your feedback about this one. Thank you.